This video was prepared as part of the course requirements of Human Anatomy at Saddleback College. The ulna is one of two bones that are located in the forearm. When a person is standing in anatomical position, the ulna is the most medial of the two bones. Starting from the most proximal portion of the ulna is the olecranon process. The olecranon process is the curved portion on the proximal end of the ulna. The olecranon process articulates with the olecranon fossa on the distal part of the humerus. Looking at the posterior portion of the elbow, the olecranon is the bony projection that can be felt at the elbow. Muscles that attach to the olecranon process are important in the extension of the arm. A major muscle that inserts into the olecranon process is the triceps brachii. Its origin is the infraglenoid tubercle in the posterior humerus, and it inserts into the olecranon process. The trochlear notch is located distal to the olecranon process. The trochlear notch is a location where the trochlea of the humerus articulates with the ulna. The coronoid process is inferior to the trochlear notch. The coronoid process has a similar pointed structure such as the olecranon process. The coronoid process is the point of insertion for the brachialis muscle. The brachialis muscle function is to flex the forearm. The radial notch is located on the lateral side of the coronoid process. The radial notch is the site where the head of the radius articulates with the ulna. The radial notch and head of the radius articulate together. This, along with the head of the ulna and ulnar notch of the radius, keep the bones together. The ulna and radius move together to allow the arm to pronate and supinate. The head of the ulna is located on the distal end of the ulna. The ulna is different than most bones because it has its head located on the distal portion rather than the proximal end of the bone. Lateral to the head of the ulna is the ulnar notch of the radius. The ulna and radius articulate at this joint also and form the distal radio-ulnar joint in between the two. On the posterior portion, the point on the most inferior part of the ulna is the styloid process. The structure that projects out on the lateral side of the wrist is the styloid process. Attached to the styloid process is the ulnar collateral ligament of the wrist. The ulnar collateral ligament keeps the wrist stable and prevents it from overextension. When a person breaks their arm, the ulna is one of the bones that could break. Most breaks occur in the shaft of the ulna because that is where the bone is weakest. The ulna is smaller in diameter than the radius, which makes it easy to break if there is a lot of pressure applied. The ulna plays a supporting role along with the radius to keep the forearm stable. It has multiple muscles and ligaments surrounding it that help move the arm.